Mr. Jones.
Hi.
Hi, I'm Jennifer. Do you remember me? I'm the nurse.
Yeah, I remember you.
Okay, well, we met a couple weeks ago. Thanks for coming into your appointment. How have you been since our last time that we met?
Well, I've been a little stressed out. I haven't been sleeping well.
Okay. Any more episodes of chest pain?
No, I haven't had any more chest pain.
Okay, what about the swelling in your feet?
My swelling in my feet's looking better.
Okay, good. Yeah, it does look better than the last time we met. Very good. Well, you said you haven't been sleeping very well. So you've been feeling a little bit fatigued? Some lack of energy?
I'm just a little stressed out. My wife's constantly telling me how much I snore. I just can't sleep or stay asleep. I go to bed around 11. I watch the news for about an hour. And then I wake up at 5 for work.
5 a.m., that's pretty early. Do you drink any caffeine at all?
Yes, I actually love caffeine. It's one of my downfalls. I drink a cafe con leche in the morning. That's my favorite.
Okay.
And then I have a big Coke at lunch, and then I have a sweet tea at dinner.
Okay. Yeah, so a little bit of caffeine here and there. Do you use any kind of sleeping aids, like a sleeping pill, or?
No, I don't use anything to help me sleep.
You said you keep the TV on while you're sleeping?
Yes.
Okay. Until about 12.
Right.
You said-ish. Okay. All right. Well, tell me a little bit about your family, if you don't mind.
Well, it's me, my wife, and my 2 kids. I'm the sole provider. My wife's kind of a stay-at-home mom. She doesn't seem to mind, although she does say that I've been a little bit more irritable lately. I've been praying more recently. I was raised Christian, but I don't really practice it. But
Okay.
I've got a lot of financial obligations. I want to make sure my kids can go to college. I'm just afraid I'm going to lose my job.
Okay. Do you have a lot of friends or how about support outside the family?
Yeah, well, I have a couple of coworkers I'm friends with. We used to go fishing a lot. I haven't really gone fishing with my coworkers in about 6 months or so.
No fights or anything, just
No
time?
fights, no.
Okay.
Just financial obligations, and I just don't really feel like it anymore.
Okay. Do you spend time alone at all, or?
Not really. I do on occasion on the weekends. I spend some time with my brother. We'll have some beers, throw a few back and catch up. He drinks a little too much, but I'm conscious to limit my amount.
Okay. As a crane operator, though, do you spend time alone a lot? The cranes usually. I'm not familiar with those, but are you sitting by yourself in there? A lot of time for
Yeah, I
reflection
do
and
spend a little bit of
thinking.
time by myself operating the crane at work.
Now, is this okay with you, or?
Yeah, I don't have any difficulty being alone.
Okay, good. All right. So you said you've been having some financial issues recently. Any other stressors things have been bothering you?
Well, I said, I'm just concerned I'm going to lose my job, and I have a family to support, and, I pay for the bills, and I'm the one that has to pay for our single-family home and all the electricity and water.
Okay. What are some coping mechanisms for your stress what are some healthy outlets for your stress?
Well, I don't know if it's healthy, but like I said, I go have a few beers with my brother, and that helps me unwind a little bit.
Okay. Any drinking problems with you or your family that you're aware of?
No, my brother might have a little bit of a problem. I don't think I do. I only have a few beers.
Okay. Yeah. Okay. So do you think that drinking, you said you used to go fishing, right? But you think that drinking, it really does help relieve your stress?
It helps me, yes, it does. I think. I feel a little bit more relaxed when I drink.
Okay. All right. Do you smoke?
No, I quit. I used to smoke from about 19 to 50. But I have quit for about 5 years now.
Okay.
It was hard. It took me 2 times, but after that episode of chest pain, I was sure to stop.
Okay. How many packs a day did you?
It was about a pack a day.
Okay. All right. And you smoked daily for 19 to 50. All right. When was the last time you drank alcohol?
Probably last weekend.
Okay. All right. And still the same amount, about 6 to 7 years. All right. Out of the last 30 days, how many times have you drank alcohol? How many days out of the last 30 days?
It's been just about every weekend.
So about 6 days. Okay. All right. So besides your brother, does your father, anybody else have a drinking problem?
No. Not that I'm aware of.
Okay. Any use of recreational drugs?
No, never.
Okay. So, no marijuana, cocaine, barbiturates, heroin, LSD, amphetamines, cocaine, ecstasy. Have you ever received any kind of treatment for drugs or alcohol that you're aware of? Okay. Has your brother been into any kind of rehab at all for alcohol? Okay. How much time do you spend with your kids?
Not as much as I should. I'm busy working, trying to make money to pay the bills.
Right, okay. Do you exercise at all?
No, I don't. I know I should. I'm a little overweight.
Okay. Do you like to read or watch movies?
I've never really been a big fan of reading. I enjoy watching some TV, you know, right before I go to bed. I watch the news and like to catch up.
Okay. All right. Well, what I'm hearing is that you have been having some fatigue and some, it's some stress. Stress leads to high blood pressure, which we talked about last time we met. And basically, when you are lacking in sleep, that's going to cause a great amount of stress in your body. Sleeping from 11 to 5, that's not enough sleep recommended. You should get about 7 hours of sleep a night, 7 good hours of sleep, not 11 o'clock to 12 with the TV on. You should get 7 hours of good sleep. So maybe think about going to bed at about 10 o'clock and turning off the TV, getting some quiet or maybe some kind of a white noise that could therapeutically help you just concentrate on some sleep. I would recommend cutting out the sweet tea at dinner, even maybe the Coke at lunch. Coffee first thing in the morning still isn't great for you. It isn't the best, the healthiest thing, but cutting out those extra bits of caffeine can really help enhance your sleep.
Yeah.
Exercise during the day or before bed, not right before bed, but a couple of hours before, maybe before dinner. Go for a walk with your wife or something like that. That would be a good time for you to talk about your stresses with your wife and just get that out there, as well as exercising your body.
Right.
Or even maybe exercising with your girls or with your, not sure if you have girls, but with your kids.
Yes.
Also, alcohol really can affect your sleep and wake patterns. It does. It's a stimulant, basically the same as caffeine. So if you're drinking a lot of alcohol on the weekends, that can affect your sleep pattern through the week.
Right.
Okay. So that should help you increase your energy, and also it should help to lower blood pressure, like we talked about before. We want to keep that low to prevent any other future stressors, such as heart attack, stroke, heart failure. All these things can come from high blood pressure, and hopefully it'll help you to reduce your weight. Because we talked about last time you're in the overweight category. Helps reduce your weight if you get some exercise and cut out some of those sweets. So those are just some examples of things you can do to increase your health. Any questions that you might have at all?
No. That all seems like great advice. Maybe I should try a little bit of it.
And I'd recommend keep going fishing if you can. If there's any way that you can, I know it's financially right now you're tight with money, but if you have old supplies that you can renew, go ahead and use those. Because that's a good way for you to reduce stress and to kind of, just stop thinking about other things and maintain a healthy, positive outlook on life. And I know you said you've been praying. That's good. Try and go to church. Those are all healthy outlets for you to reduce some stress and to increase your energy in your life. Okay. All right. Well, thank you so much.
Thanks for
and
your
advice.
advice.
Follow up with me next time.
Thank you
I'd
so
appreciate
much.
it. Okay.
Thank you.